Hello and welcome. Thanks so much for joining us today. I'm your host for today's program, Brian Banmiller, and I'm pleased to bring you Dr. Robert Ioppolo from Hill & Ioppolo Oral and Dental Implant Surgery of Lubbock. Dr. Ioppolo, it's wonderful to have you here today. Welcome.
Thank you, Brian. It's wonderful to be here.
36 million Americans do not have any teeth, and 120 million people in the U.S. are missing at least one tooth. Why?
Well, people lose teeth for a variety of reasons. It can be dental decay, so cavities in their teeth. It could also be due to trauma from, say, a motor vehicle accident or a sports-related injury. Also, periodontal disease. It's a very common one where patients lose gum and bone support for their teeth.
What are some of the other options for patients looking to treat their tooth loss?
So removable things like dentures and partial dentures, those are prostheses that have been made by dentists for many, many years. And for the patient who is not concerned about having something that is removable, those are still viable options. But most of my patients, Brian, when they come in to talk to me, they don't want something that's removable. They want it to be permanently installed so that it gives them more confidence in their ability to chew and smile, and it looks more natural.
Well, also feels more secure in the mouth, doesn't it?
Absolutely, it does.
So, Rob, just what is a dental implant?
Brian, dental implants are titanium structures that are placed inside of the bone underneath the soft tissue in order to replace one single missing tooth or multiple missing teeth, depending on what the patient needs.
How does it differentiate from dentures, the ones that I knew from 50 years ago, people got dentures?
So dentures don't have anything to support them other than just the underlying soft tissues and bone. Partial dentures are clasped to remaining teeth, and that's what provides the stability for a partial denture. But both of those devices, as you stated, are removable. And this is not. This is something that's permanently installed. And so it gives a patient a whole lot more confidence in their ability to chew their food, to smile. It feels very natural as well.
And they don't feel like it's going to fall, the dentures are going to fall out on them, which
Exactly.
has always been a problem for ages. It's embarrassing.
Absolutely. It's a very stable, permanent restoration.
Let's hear from Melissa, a recent patient of yours, about her dental implant experience.
So my procedures have been exactly as they told me they were going to happen. They're very quick, very easy. Recovery always went really well. Within a day or two, I was back. It's the first time in 4 years that I've been able to chew naturally on the left rear molar. Everything has gone really well. Dr. Ioppolo was super warm, super professional, very inviting, very informative about what was going to happen. He took the time to explain things. He answered all my questions. Everything went really well.
Tell us about Melissa.
Melissa was a very interesting case. She came to me after she'd been seen elsewhere for a bone graft in preparation for a dental implant. Sadly, that bone graft had failed, and so she did not have a sufficient amount of bone for us to put a dental implant into the space. So we started over. We put a fresh bone graft in there, got that to heal appropriately, and then we placed her implant. And at this point in time, her case has been completely restored, and she's back to normal.
Rob, how important is technology to your practice?
I'd say it's vitally important, Brian. We are able to do a cone beam CT scan, which is a small field CT scan of just the upper and lower jaw, and marry that up with a intraoral scan, which is basically a digital camera that takes pictures of the patient's teeth and gums. And with that two-level information, we can create a very complex, very accurate surgical guide that allows us to pre-plan the entire procedure ahead of time. And I think that gives patients a lot of confidence in the process, knowing that the surgery will be done with great precision.
Technology, particularly in the medical field, is explosive. So how do you keep up with all the changes in technology?
So our continuing education program that allows us to know what is available out there and to see the difference between doing things in the analog age versus the digital age, it's quite eye-opening. And when you show a patient, we're going to do this entire procedure ahead of time on some models that we create digitally before we do it on you, it gives them a lot of confidence in the process.
So Rob, tell us a bit about the process.
Well, Brian, when a patient comes in with a failed tooth or a missing tooth, oftentimes we can remove that tooth and place a dental implant at the same time. It's what's referred to as an immediate dental implant. In other cases, the amount of bone structure that's there is not sufficient to allow for an immediate implant to be placed. So we'll do a bone grafting procedure that will build that back up to a nice thickness and support structure that will allow for the implant to be placed later on. After a dental implant is placed, and it's healed for about 4 months, then the implant is tested to make sure that it is integrated and healed. And at that point in time, the restorative dentist will go ahead and place a crown on top of it.
So what is the all-on-4 treatment concept?
The all-on-4 treatment concept, Brian, is where we take out all of a patient's non-restorable teeth and we replace them with at least 4 dental implants. And those dental implants are then hooked up to a fixed bridge that will replace all of the teeth in a patient's arch, whether we're talking about the upper jaw or the lower jaw. Sometimes this is referred to as pro-arch, depending on the manufacturer of the implants that the surgeon is using.
So what makes this so unique?
What makes it unique is that it happens all in one treatment time. And so a patient would come in with all of the teeth needing to be removed. The bone needs to be smoothed down flat like this tabletop. And then we put in the 4 dental implants that are like the legs of a chair to provide stability, and the bridge on top of the 4 dental implants, which is what you actually see when you smile. It's what you chew with when you function. Now, this particular bridge can be functioned on the actual day of surgery. So the patient can resume eating softer foods during the healing period, but they can eat later on that same day. Whereas what we talked about earlier, Brian, with the single dental implants, that cannot have forces placed upon it after the implant is placed for about 4 to 6 months. But with the 4 implants working together in concert, the patient is able to function immediately afterwards.
Well, tell me a little bit more about the procedure itself and then, of course, the recovery process.
Absolutely. So the procedure itself is actually much more straightforward, and the recovery is much shorter than most patients anticipate. Patients come in thinking that this is going to be a 2 to 3 week recovery, when in reality it's 2 to 3 days. So if a patient were to have surgery on a Friday, they would recover over the weekend and return to their normal activities of daily living by Monday.
Well, how long does the procedure take?
4 hours per arch. So if we're going to do the entire mouth, we're talking about an 8-hour day in order to completely restore the patient's dentition.
Let's hear from Jeannie about her personal experience with the all-on-4 treatment concept.
My teeth are very fragile from medicine I took as a child. I thought I was going to have false teeth till I came up here. And they told me about this procedure, and I decided to go for it. Dr. Ioppolo is phenomenal. He explained to me how to do the all-in-4 and what my teeth would look like when they were finished, and knew that that's what I wanted to do. The staff here is very friendly, and everyone here was always kind to me. They're just real sweet, every one of them. And I just felt comfortable being here. The surgery went great. I just almost cried the first time I ate, and it didn't hurt.
Rob, tell us about the life-changing experience Jeannie had.
Well, Brian, in Jeannie's case, she came in with a chief concern of not being able to chew her food without pain. She had lost several teeth. She had others that were broken, fractured, and teeth that were mobile because of loss of gum and bone support. And it caused her to have a lot of pain when she would eat. So when we provided her with full arch restorations, dental implants, and fixed bridge work, it was a complete game changer for her. It restored her to full health and confidence.
Tremendous confidence, I'll bet.
Tremendous.
Well, it sounds like a truly life-changing experience. I mean, how does a patient get more information about this all-in-4 treatment concept?
The patient just needs to call our office and or go on our website, and they can find all the information that they need there to take next steps. A first great step would be a video consultation where we can see if a patient is a good candidate for the procedure. Anybody who's thinking that they might not be a good candidate and maybe they don't want to make a drive in to find out that they aren't or they are, we can help obviate that by seeing them for a video consultation ahead of time and then bring them in for a more comprehensive look so that we can go over exactly what the treatment entails, how long it will take, and when we can get them on the schedule to do it.
So what makes the dental implant so unique?
Well, there's a process, Brian. So initially, the failed tooth needs to be removed. And at the same time that we remove the tooth, we would place a bone graft inside of that socket. It's a technique called socket preservation. So very simple, straightforward to replace any missing bone that's in their socket and also to preserve everything that is there so that when we come back to place our dental implant, it will be placed into some very stable, permanent bone.
Let's hear from Teresa, a recent patient of yours, about her dental implant experience.
I had a back molar that was giving me some problems, so I went and had a root canal done. And a couple of months later, it was still giving me problems. They told me that it probably just was not going to work, that I might have to look into having a dental implant. The procedure went great because I knew exactly what was going to happen. Everything had been explained to me prior to the procedure. Dr. Ioppolo is a very, very friendly person. He explained everything in detail, all the different stages and steps, and it really put my mind at ease. This office is one of the friendliest offices I've ever gone to. The front staff greets you when you come in. Everybody is knowledgeable and courteous and makes you feel almost like part of the family when you walk in.
Tell us about Teresa.
Yes, Brian, Teresa, she came to me with a tooth that had fractured and become abscessed or infected. It was causing her a lot of pain. She couldn't eat her food properly. She'd seen her dentist, and the tooth was deemed non-restorable, meaning there was nothing that anyone could do to fix it. It just needed to be replaced. And so in Teresa's case, we were able to remove her fractured tooth, place a bone graft into that area, and later, after that bone graft healed, we came back and did a small sinus lift procedure to make some more vertical space for the implant and placed our dental implant in there. Today, that implant has been restored, and now Teresa is back to her normal function.
So, Rob, can you tell us about the procedure and the recovery process?
Yes, sir. So the procedure is done under general anesthesia. That means that the patient is asleep completely, just like they would be in a operating room at the hospital. We have an anesthesiologist that comes in and monitors the patient safely while we are performing the surgery. So we've got a team of folks, all highly qualified individuals, ready to take care of patients and make them as comfortable as possible.
That cuts down on the anxiety, doesn't it? So you're going to be under a general, and most people understand that, and that has to put them at ease.
It does. Oftentimes, that's the thing that they're most worried about is, am I going to be awake at all during this? Am I going to feel anything? Am I going to remember anything unpleasant? And with the general anesthesia, we can say confidently, no, you won't.
Let's hear from Sue about her personal experience with the dental implant procedure.
It has been a much easier process than I thought it would be. I anticipated that I would be sore for a long time. I've had very little discomfort. Dr. Ioppolo is a very caring man. He has made the dental implant process about as easy as it could be made. When I come into this office, I'm greeted by a very friendly, welcoming staff. They do have a gentle way of approaching. They're sensitive to what's going on with you and thoughtful about how they approach working with you. I had a great experience here.
Tell us about Sue.
In Sue's case, she had a tooth that had previously been treated with a root canal, and this is something that we see rather often. In her case, it was not restorable, and the endodontist referred her to us to take out her tooth, to replace it with a dental implant, and also to do a small sinus lift, a vertical augmentation of the sinus to allow for the implant.
How much discomfort with this procedure?
Well, so we give patients general anesthesia, which allows them to rest comfortably throughout the procedure. There's an anesthesiologist who comes into our practice to watch over them while they're resting and while we're doing the actual surgery. And at the end of the procedure, we will inject a long-lasting local anesthetic, which is called Exparel. And it allows the patient to have numbness in the surgical sites for many, many hours afterwards. So the discomfort immediately afterwards, patients tell us that they usually have a couple days of follow-up associated with that recovery period. And then by the third day, they feel like they're pretty much good to go, back to normal. As far as the dietary modifications, that is something that needs to happen in order to allow the implant to integrate, in order to allow it to heal fully. So initially, yes, a patient has to choose a softer diet for a period of time.
How long is that?
It's usually about 4 to 6 months, depending on what the x-ray looks like, what the clinical exam shows. After that time, when we're confident that the implant is integrated, the patient can have the implant restored, and then they can go back to enjoying the foods that they love.
So how does the procedure affect a person's overall health?
It can be very profound, especially if a patient has been missing their teeth for a long time. They've changed their diet to eat softer foods. A lot of the things that you and I enjoy eating, like corn on the cob or steak, they can't eat when they've been missing teeth or they've been wearing dentures that are ill-fitting. And so when you restore the patient's dentition and they're able to have a full complement of teeth that are healthy, that they will enjoy smiling with, they can also eat more comprehensive, balanced diet and have the foods that we all would like to eat that they've been missing out on for some time.
Let's hear from Melinda about her personal experience with the dental implant procedure.
The surgery went very well. They gave great directions for aftercare. I have really enjoyed working with Dr. Ioppolo. He is as competent as it comes. He is kind, compassionate, caring. The staff is just great, start to finish. Walking into this office is sort of like walking into someone's home. I just felt welcomed. They were very professional, but also very kind and caring and compassionate. And I'm doing very well now.
Tell us about Melinda.
So Melinda had a tooth that was fractured, and she had a root canal treatment done, Brian. Ultimately, that root canal treatment didn't pan out, and the tooth needed to be extracted. So we were able to extract the tooth, resolve the infection in that area, replace the tooth with a dental implant, and get that implant restored. So at this point in time, Melinda is back to normal function without any infection or problems.
How does this affect the life of the patient?
Well, it's a huge enhancement to the life of a patient who's been living with either painful teeth, missing teeth, unable to chew food like they normally would. It can affect their overall health and well-being because their dietary modifications that they have to undergo can't really eat the things that you and I can eat when you have to modify your diet to softer foods.
And what about the patient's psyche? Do you find after a procedure like this that their mood changes, but just their whole aspect of quality of life, a skip in their step?
Right, absolutely. They come in with a whole lot more confidence, Brian, because they're able to smile and they don't have to worry about things like the teeth moving around while they're talking, while they're eating. The dental implants provide a structure that's stable support to prevent any of those type of problems.
You can imagine we've come so far with this, haven't we?
Absolutely.
You know, this, Rob, sounds like a really life-changing experience. What's the best way for a patient to get more information about dental implants?
Absolutely. Well, we can do a preliminary video consult, Brian, from the comfort of the patient's own home. We can visit with them about the procedure, what all is involved, and if the patient is a good candidate and they would like to pursue further investigation, we'll bring them into the office and start to utilize some x-rays and clinical exams to make sure that we get the right plan in place for the patient.
So tell me, Rob, what's the real mission of your practice?
Well, our mission statement, Brian, is to serve God by leading, treating, and teaching with passion and compassion. To say it another way, we want to treat people like we would treat our own family members.
So what sets your practice apart from other oral surgeons in your area?
So in our practice, a patient that would come in could expect that from the moment they come in through the front door, that they'll be greeted kindly, warmly, that they'll be cared for as a person, as a complete person, that they will have a very precise and clear view of exactly what it is that we're trying to accomplish for them, and that when they come back for their follow-up, that we will see them until any and all issues are completely resolved.
Can you expand a little bit on this patient-centered care that you talk about?
Patient-centered care is something that we do in our practice to make sure that anyone that comes in through our door is taken care of completely from the time that they enter our practice and we see them for their consult until we discharge them at their follow-up appointment. Whatever their issue was when they came in, it's completely resolved by the time that we discharge them.
So what's it mean to treat each patient like a member of your own family?
Well, Brian, to me, it means that the decisions that we make and the choices that we give a patient would be the same that we would do as if I were treating you and you were my father. So I'm going to give you only the options I think are best for you, and I'm going to help you decide which option you ultimately feel most comfortable with.
So what does it mean to choose an oral and maxillofacial surgeon?
So an oral and maxillofacial surgeon is an individual who initially trained at dental school and then went on past dental school to complete a surgical residency. That's a hospital-based residency training program that is at least 4 and sometimes 6 years long. And at the completion of that particular residency training program, you're able to do some procedures that folks that don't have that level of training are not capable of doing. So you get exposure to things that are surgical in nature, surgical-based, hospital-based. So in my career in the Army, that meant a lot of trauma, a lot of reconstructive surgery, a lot of things from ballistic injuries that we saw from patients coming back from war. And so you can extrapolate and you can apply all of those things to placement of dental implants, to bone grafts, to removal of teeth. It's similar, but it's on a much larger scale necessarily when you're seeing patients that have come back with those type of injuries, but it all is applicable to what I do on a day-to-day basis.
Oh, it's frightening, those kinds of injuries. But what stops people from trying to take care of their teeth in various ways? Well, what's the impediment?
Sure. I think in a lot of cases, Brian, it's fear of pain, fear of judgment. The patients are very self-conscious. They feel like they'll be judged because of the condition of their mouth.
Oh, I see.
And we take a look in there, and what I can tell them confidently is, I see this all the time. And it's not something that you need to be fearful of or expect that there's going to be any judgment from anyone in our practice. We only want to help.
That actually helps both the doctor and the patient. It helps the patient ease that anxiety so they can make a commitment that they need, and it helps the doctor with his timing.
It does. And so every patient that comes in after the video consultation has already a good idea of exactly what we're talking about doing, what it looks like, and the timing of it. And all we need to do at that point in time is take the requisite x-rays and do the examination in order to make sure that the patient is indeed a good candidate for the procedure.
It saves time for both the patient and the doctor.
Yes, sir, it would.
Now, you're in a local community. How important is it to maintain contacts with other dentists and surgeons in your area?
So if a patient has an existing dental home, Brian, a place where they go and have their regular examinations and teeth cleanings, then we will work with that particular individual on coordinating this care and doing an all-on-4 or a pro-arch type of procedure for a patient. If they do not, then we have several different providers that we work with very regularly, and we will refer them to one of those particular individuals to restore the case after the surgical phase is complete.
Yeah, but those kinds of relationships, that primary dentist may then refer their patient to you for your procedures.
Absolutely. So it can go either way, depending on where the patient is coming from, if they're coming from the primary dentist to us, or if they happen to see this show that we're doing and they come directly to our office and they are in need of a restorative dentist. Either way, we can work that out for the patient and put together the best team to give them the best possible resolution.
As a Texan, I suppose I said that right. As a Texan, that's kind
Yes.
of a unique thing. What does it mean to serve the local community in Lubbock as a Texan?
Well, as a Texas Tech graduate as well, Lubbock is near and dear to my wife and I. We both graduated from Tech, and we love to serve in this community. And serving at our practice is one way that we do that, giving back to others through the programs that we participate in, as well as serving in many different avenues throughout Lubbock and the South Plains in order to help those in need.
How important is your mission to the people in the community?
I'd say it's critically important. It's everything. It's what drives us. So no reason to show up every day and put your boots on if you're not serving people.
Tell us a little bit about this Smiles for Soldiers. You've been doing that for about 5 years?
5 years, yes, sir. That one is really incredible. I enjoyed that so very much, being able to award someone with the gift of a full arch restoration. So it's what we were talking about earlier, Brian. It's this concept of removing all of a patient's teeth and replacing all of them with dental implants. And we do this complimentary for a veteran in our community on an annual basis.
A veteran because, of course, you spent 9 years in the Army and then 4 years in the reserve. So you
Yes.
have a certain patriotic part of your heart in there, huh?
Absolutely. It's key to me to be able to continue that connection with the military community, although we are no longer in active duty service. And this is a small way that we can keep that going.
Let's hear from Gregory about his personal experience with the all-on-4 treatment concept.
I was in the Army, and I was in there for 4.5 years. The Smile for Soldiers program was something that I didn't know about. I had never won anything before in my life, so I felt like I had won the lottery. Dr. Ioppolo is a great listener. He's a fellow veteran, so we're like brothers. I just feel comfortable with him. He's a good guy. Doing things for veterans that there's hardly anybody out there that is doing this. He explained to me things very well, and I understood everything that he was trying to tell me. The staff here is great. They make you feel at ease as soon as you walk in that door. Everybody's so nice and friendly, and I just felt at home here. I had surgery a week ago, and I feel great. I've had a good experience here. We had been praying for, things to happen in our lives, and I'm so happy, and I'm just so honored to be chosen.
Tell us about Gregory.
So Gregory was in the Army, and while he was in the Army, he had all of his teeth extracted because they were broken down, decayed, And he was given a set of dentures, but they didn't fit well at all, to the point where he never wore them. And he became somewhat of a homebody, didn't want to go outside of his house because of the anxiety and the fear revolving around people judging him for not having any teeth. And so his wife told me that he wouldn't even go to church with her, which was something that they had always done. And so when we did his full arch restorations and gave him permanently implanted teeth, Gregory came back to see me for follow-up. And he told me that he was having some pain right here on either side. And I said, well, Greg, what do you think that's from? And he said, it's from smiling so much.
What a terrific end to a wonderful story.
Yes.
What drives you?
Community service to the people that God brings my way. Every time that we see somebody in our office, it's an opportunity to love and care and minister for that person in a way that is very special.
So, Rob, we talked earlier about your military experience, 9 years on active duty and 4 years in the reserves.
Yes, sir.
How did that help you with your practice?
Well, Brian, it was a privilege to be able to treat active duty soldiers coming back from a wartime injury. And the types of things that we saw in that particular environment sometimes were devastating injuries that we were able to improve upon the quality of life for that individual. So it puts me in the frame of mind where whatever comes through my door, there's not going to be anything that's insurmountable. There's not anything that we can't improve upon. There's not any problem we can't solve.
So tell us a little bit about the staff and the environment that's at your practice.
So, Brian, I think it's critically important that you have longevity with your staff. The only way that you can truly interject your vision for patient care and have everybody on the team kind of, involved with that vision and really sold out into what we're trying to do is to have them around for a long time. And at our practice, we're blessed to have staff members that have been with us for decade plus.
Dr. Ioppolo, let me thank you again for the information today. It's been a wonderful experience. I've learned a lot. Thanks again.
Well, thank you for having me, Brian. I really enjoyed the visit.
If you or your family are interested in hearing more about dental implants or a full arch restoration, please call or email the staff at Hill and Ioppolo Oral and Dental Implant Surgery of Lubbock for a consultation. For myself, Dr. Ioppolo, and the staff of Hill and Ioppolo, thanks so much for spending some of your time with us today.
I came to Dr. Ioppolo because I needed dental implants. There were certain things that I could not eat before the implants because my teeth kind of wanted to slide around. First time I met Dr. Ioppolo, I was very impressed and fell in love with him right away.
As soon as I walked in the front door, they were very welcoming to me. And then once I met Dr. Ioppolo, I just felt like I'd known him all my life.
Dr. Ioppolo is the best. This whole staff here it made me real at ease, real comfortable to come. Real good people. Procedure went real well. Taking the teeth out, of course, that's the first time I'd ever had oral surgery. And the implant I had put in feels just like natural tooth. It's just like the one he took out.